Hi, everyone. I'm delighted and really honored to be here at the American Society of Hematology, or ASH meeting 2023. I'm joined by my friends and colleagues, Ann Brazow and the team here, and really trying to understand what are the important updates for our patients, caregivers, and family members for those patients facing myeloproliferative neoplasms, or MPNs. I have a lot of excitement and really a lot of hope for our patients and caregivers to share, and really three main buckets to share with you from the meeting. Number one is that there are novel therapies that are being actively investigated in later stage of clinical trials. So just to remind everyone, when these new drugs come out, they have to be tested in the lab, in animals. That's called preclinical studies. Then we have the early studies that many of you are familiar with. Those are called phase 1 and 2. We've seen many of those come through. Unfortunately, many of those don't result in FDA-approved drugs, as the majority of trials have to go under rigorous safety and efficacy testing. But I'm proud to tell you here at the ASH meeting, we have two separate, large, randomized phase 3 global studies with novel combinations in patients who've never had a JAK inhibitor, so frontline myelofibrosis. So we'll see the exciting data. One of those is the navitoclax combination with ruxolitinib that I'm personally leading, so we'll be presenting that here at the meeting. And the other, my friend and colleague, Dr. Rajit Rumpel, will be presenting the pelabresib, or BET inhibitor data in combination with Rux. Again, just the size and scale and scope of these trials is important for our patients. Phase 3 trials randomized to ruxolitinib alone are standard in the field, and that they were largely conducted through the COVID-19 pandemic time, showing us that the research was even possible. So let's await those data and discussions, but certainly that combination therapy versus single-agent JAK inhibitor can be important, clinically beneficial, and may improve overall outcomes. Let the debate and discussion begin. Number two development that I feel is very exciting is the development of mutant-specific inhibitors and agents that are finishing the final stages in the lab, and we hope to open up clinical trials in 2024. So as many of you remember, there are three major mutations or driver mutations in the MPNs, JAK2 V617F, of course the most common, followed by CALR, followed by MPL mutations. Together, those three mutations make up, let's say, about 90% of our patients. The CALR in particular is very important, as to the very day, here in December 2023, this is the 10-year anniversary since the elucidation of that mutation, which is the second most common one in our field, led by our friend and colleague, Dr. Jyoti Nangalia in the UK. Why is this important? In just 10 years, the field has now moved to targeting specifically those mutations. So CALR appears to be what we call immune sensitive, and so maybe immunotherapy approaches, including but not limited to CAR T cells, hopefully in the future, bispecific agents, monoclonal antibodies. We hope to have some of these in the clinic in the next year or two. But even our familiar JAK2, which many of you know and many of you have this mutation, we've been previously targeting it what's called the wild type, which is all patients regardless of your mutation status. So remembering that the ruxolitinib, fedratinib, pacritinib, and now momelotinib, these four drugs are not mutant-specific. They actually can benefit all patients with intermediate or high-risk disease. But now, can we target the JAK mutation specifically? And so different sponsors and clinical trials we'll see in the next year or two, and we'll start to see those preclinical data. Now, the third exciting aspect of the field is that of the rare diseases, so the even more rare diseases than our polycythemia vera, ET, and MF, are those of you and your families who face some of these diseases that historically you don't even find much information: systemic mastocytosis, hypereosinophilia, etc. I'm really proud to share with you that in the very first oral session already done here at ASH, that there were 3 separate clinical trials and data sets presented on just our systemic mastocytosis, featuring a new class of drugs called KIT inhibitors and beyond, which really can help patients with both the indolent form, so the more chronic version, and then the more aggressive or acute form. So I was really proud of both ASH and also our community for doing those studies, featuring those studies, and getting the word out there. And so these are just some of the many things that I'm personally and professionally excited about for our patients and families with MPNs. And I want to just say thanks to all of you for keeping the research going, keeping the hope going, keeping the energy and enthusiasm going, despite 3 years of pandemic time, now in our rear view window, but the field is ablaze with all of these new developments, and it's really thanks to all of you out there. Let's keep it going, and let's have our best year yet in 2024. Thank you so much.